Hello, my name is Cassandra. I'm going to be doing your neuro and mental status exam today.
Hello.
How you doing?
Good, good.
All right, can you please start by telling me your name?
Sure, my name is Ant.
All right, Aunt. And do you know where we are today?
Yes, we're at the office, doctor's office. I came in for examination
Yeah.
today.
And what's today's date?
I believe it's June 10.
Correct. All right, great. So my patient is oriented to person, place, and time. He is also dressed appropriately. His speech is clear. He doesn't have any words that don't make sense. He seems to have ease of speaking, and his thought process does seem to be intact. So I'm going to test your current memory. I'm going to give you 3 words to remember, and I'm going to ask you to repeat them back to me in a little bit. Let's see, let's do pen, tree, and car. So keep those in mind. We're going to test his short-term memory to see if he can recall the words I gave him as part of the mental status test. And so while you think about those words, we're going to go on to testing your cranial nerves. I see you wear glasses, so he's clearly had a Snellen test. And we're going to also test your cranial nerve 1, which is your olfactory control smell. So I would take something that smells maybe good and plug one nose and ask if you can smell on this side. What's it smell like? Can you smell it?
Yeah, something fruity.
Fruity, yeah, it's tropical mango. So very good. So cranial nerve 1 seems to be intact as you can smell. We'll test cranial nerve 2, which is his visual acuity and his visual fields. So I'm going to take my fingers and wiggle them towards you. Look straight ahead and let me know when you see the fingers come on the left side.
Something is coming.
You see? And how about on the right? Wait, now look at me.
Yeah, 2 fingers.
Okay. So we can see his peripheral vision, and then we can hold a finger here. Tell me when you can see how many fingers I'm holding up. Can you see how many fingers?
1.
Without looking?
1.
How about here?
2.
How about here?
2. 3.
How about here?
1.
Okay. So we can see his the range of his peripheral vision. Next we'll test ocular nerves 3, 4, and 6, which is your oculomotor, trochlear, and abductans. Gosh. And how we're testing is to see if it's a smooth movement, and if we see any jerking or nystagmus, then we can tell that there's a problem with one of those nerves. And we do that by testing the 6 cardinal fields. So look at my finger without moving your head, just your eyes. And I'm looking to see that we have smooth motion of the eyeballs and that you're able to follow. And then we're going to test for convergence, which is crossing. I'm going to take my finger and push it towards your nose and just watch it. I'm looking for a slight cross, and which they do, so that's all good. Next, we're going to test cranial nerve number 5, which is your trigeminal nerve. And we're going to feel, clench your jaw. We're going to feel his muscles, and I can feel that they're clenching. And I'm going to have you press against my hand. I can feel resistance. And then also close your eyes. Now we're going to test your sensory. I'm going to lightly touch, and you just tell me if you feel my finger or not.
I do, on this side. Yes, on this side.
Yes? Alright. So, sensory and motor both seem to be intact for cranial nerve number 5. Cranial nerve 7 is your facial nerve, and we're going to ask our client to please just repeat facial expressions such as, can you grimace, like frown your eyes? Can you give me like a big smile showing your teeth? Very good. Close your eyes tightly and don't let me open them. Okay, very good. And puff out your cheeks. Good. So if we had any asymmetry, or when he puffed his cheeks, if air came out, we would know that there may be something going on with cranial nerve 7. Cranial nerve 8 is hearing. So what I'll do here is a little whisper test. Plug one ear and whisper a word, ask him to repeat it.
Computer.
And then we do this on the other side.
Left.
And he has hearing on both sides. To test cranial nerve 9 and 10, we can test together by having the client open their mouth and say ah, and we're gonna look for symmetry in the soft palate, and we're gonna look for the uvula to raise and lower. So if you can say ah, stick out your tongue a little bit, and ah. Good, so we see that it is even, and go ahead and swallow, testing our vagus nerve. And then to test nerve 11, your accessory nerve, I'm going to have my client press up against my hands and shrug, very good. And then also press against my hand, and you can see that he has proper use of his sternocleidomastoid muscle, and everything is working properly. Cranial nerve 12 is, we're going to stick out your tongue and make sure you can move it to left and right, up and down. Alright, so cranial nerves look good for this client. Next, we're going to move on to testing, since I have you seated, I'll start with some deep tendon reflexes. So just go ahead and flex your arm gently here for me, and I'm going to test your bicep. Good. We're going to make sure to do both sides. We're looking for a reflex of +2. +3 or 4 would be a little hyperactive, and anything below that would show a decrease in reflex. So let's see if we get tricep to clench. And this side too. Test your patellar reflex. Achilles reflex. For like a twitch. Okay, reflexes look good. Let's see, do this in order. I'm going to test your muscle strength. So go ahead and take my fingers and squeeze them. Squeeze them hard. Good. Now I'm going to have you flex your arm. Don't let me pull you down. And then same, I'm going to push it towards you. Don't let me push it towards your body. Do the same on this side. So we're looking for a normal score of 5, showing that our client is full use of muscle. If he's weakly resisting, so press against my hands, then we would say a 4. And then if there's no resistance at all, it's a 0. So go ahead and press into my hand, and then against it. Very good. Press into my hand. So this client has good range of press up against and down. Press up against, down. Good job. All right. So I'm going to have you lay down, and I'm going to test the reflexes of yours on your stomach and abdomen. So it might take a little. So I'm going to take my instrument and go diagonal towards the belly button. I'm going to see him second and giggle because it tickles. But that is the reflex that we're looking for. You can go ahead and sit up. Okay. So now I'm going to see how my patient's mental status is. Can you remember the 3 words that I told you?
Pen, 3, car.
Very good. All right, so you can go ahead and step down for me. I'm going to observe this client walking. I'm looking at his gait for any shuffling, for any asymmetry, for any weakness, and ease of motion. So go ahead and walk just normal. All right, great. Now turn around and walk heel to toe for me, like keeping your feet. Your heel to toe is like this.
Okay, so on the...
So just keep your feet flat.
Okay.
And then put your heel to your toe and in like a straight
okay.
line, like you're walking on a balance beam.
Yeah.
Very good. So we're watching for balance. Good which our client is balancing lovely. So we're gonna do the Romberg test. I'm gonna have you put your feet together, close your eyes, hands at the side, and what we're looking for is any swaying, wobbling, falling over. He's very steady. Now we'll go ahead and take it one step further. I'm gonna have you put your arms out like this, and flat hands. Close your eyes. And what we're looking for is if one arm falls or drifts, but a normal test, the client would be able to keep their arms out without pulling one arm down. Right, very good. So, this concludes the neuro and mental status test. Our client looks pretty agile and healthy, and I think we're ready for the next one.